Um, so I know that it might have been in the 90s or the early 2000s. There was this whole thing with the HMOs and the quality of care that
Right.
patients are getting. Do patients still get quality care, or are they just do they get 5 minutes like customers? You know, the doctor has to go
Okay.
to this room and this room and this room and this room.
Depends upon the practice that you are are in, and it depends upon the practitioner that you're seeing.
Yeah.
Okay. There are certain practitioners who like to churn. There are other of us who believe that quality medicine is not churning. Yes, we may not make as much money, but we will see the patient. They will get our attention. We will get listened to. And we, as a patient, will feel that because our provider listened to us and our provider showed care, then we will try to do what is necessary or what our provider is advising us. As I told you, I teach students, be they nurse practitioners, PAs, medical students sometimes, and even residents. And one of my aspects of the first time that they're rotating with me is, okay, you're going to be taught how to respect the patient, which means you develop a bond with the patient by giving them respect. We were talking, one of my colleagues and I were talking before I came home, and I told that pediatrician, I said, yeah, the reason why my patients like me, because I already tell them when they're being very humble to me, I tell them, excuse me, the only one you have to be humble to, and the only one that you have to not agree with is the maker above. I said, because I am human just as you. And hence, you can agree to disagree with me, but if I'm really strong about an issue, I will voice my strength. But if you want to push back and you want to do it your way, I will try your way. Now, if it's going to, how can I say, jeopardize my license and my ability to practice, I will stand my ground and let you know that, you know what, you and I disagree, and I agree to disagree with you, but you have an option. There's other people out there that may agree with you, and if you don't want to come back and see me, it's
Okay.
fine.
Okay. So the last one, in terms of a career in the future of medicine, uh, as years goes on, will we still need more and more doctors? I mean, even with technology, uh, will there always be a need?
There will always be a need for physicians.
Hmm.
If I am not mistaken, what's interesting is I think over 50% of the physicians that are now practicing in the United States are over age 60.
Wow.
So there is going to be a shortage.
Okay.
And the reason why you need the physicians is we won't have the tricor like they have on Star Trek or other little things for many, 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 many years. You're still going to need that interpretation data, and you're still going to need that human interaction to get things across,
Right.
to decipher what is right and what is wrong. Because the machine says one thing doesn't always mean that it's totally correct. You still have to take what the machine gives you and say, these are the variables that I have to deal with. Let me see if this is correct versus this versus this. Because there may be other evidence that the machine does not know. Now, what's nice about the situation is that the machines are collecting all these data so that the variables become small or they narrow down. giving you more of a definitive option with your diagnosis and then even treatment.
Okay. So
I don't know whether you know this, but I have to put this in. My grandson has a rare disease called IPEX. He's the second or third child in the U.S. There are other people, other children who have had this, and he's only 9 months of age. There are other people who have had this disorder that's very rare. And they're even saying, this is an example of data going in to give you a narrowing down. They know what the pattern has been for some of the few others, the one or two others that have been written up about. But his physicians have said that he basically is writing his own book.
oh wow.
Disorder. He just got out of the hospital this month after being in there since September. Okay, with this disorder, and he's got some other stuff to go on later. So that's what I was trying to say about, they get this data, these are the variables, because they thought that he had Hirschsprung's disease, they thought he had some other intestinal disorder, etc. And then all of a sudden they started doing these additional testing, and then they found out, no, he's got this, this, and this, and they started narrowing down. It took them almost 60 days to narrow down as to what he possibly had, with numerous tests, some of them having to be sent to specialty labs where there are only 2 in the United States.
Okay.
And they're getting all that information, and they're now pooling it together to accumulate more information, not just rare disorder.
Okay.
So that's an example.
So I think what I hear you saying is that we will still need that human intuition and that human touch.
Correct.
Okay. All right. Well, Tommy, let's close out with, well, we're going to try not to get ourselves in trouble here, but from the medical front lines with this pandemic crisis thing that we've been going through, do you want to say some words on it? You know, what have you seen in your neck of the woods? Are we close to being out of the storm? What would you say about it?
We are still number one in the storm.
Okay.
And you have to realize that the reason why they call this a novel virus is because we've never seen anything like it.
Did you say a nouveau virus?
Nouveau, yeah.
Okay.
Basically, it's a new virus.
Yes.
Okay? We've never seen anything like it. We don't know how it totally interacts. If you think about some of the stuff that was originally said, oh, it affects the lung, affects the lung, affects the lung. Now they're talking about, no, it affects the heart, it affects the kidney, it affects this and that. What's also been interesting is they're saying, okay, you can have this virus, but you have to have a fever above 100.4, a cough and shortness of breath, and you've got it to be tested. Now they're noticing, no, muscle aches and pains, chills on and off, loss of taste and smell. These, okay, you can also have diarrhea or other GI symptoms along with the fever. So we're learning all its presentations because every human is slightly different. Okay, that's one. Number two, we really don't know how to treat it. Now, what's interesting is the plasma transfusions that they're doing and collecting plasma of those people who are affected, they're using their antibodies against the virus. So your body may be trying to build up antibodies to help get rid of this virus, but you don't have enough built up. When you do this plasma transfusion, which has more antibodies because these people have already fought it off, so their body is like high gear to produce antibodies. It's in there. So we don't know that, okay? We don't know whether there's any antiviral medication or what type of antiviral medication can be used for it. We know that it's spread via air droplets, okay? And so I've been telling my patients, the 6-foot distancing is important. Wearing a mask is important. Washing your hands is important, okay? Now, you think about this. Yeah, they want to open up the restaurants. They want to open up the bars, the gyms. They want to open up the shopping centers and everything else.
Yeah, get the economy going.
Right. It's bad enough trying to go shopping and not running into somebody who is walking by you versus you're in an environment in these shops that they're talking about where people may cough, sneeze, you don't know. It's not like we have an air filtration system that's going to suck all the air out with the virus in all these environments. You don't know who sat in that barber's chair before you, where they had gloves on. You don't know who picked up that piece of clothing at the boutique before you, where it can last. Because there is on the internet an article as to how long it lasts on different surfaces. Okay, that's the time they tell you, use the Clorox wipes. Simple Green ain't gonna work. Odabin may. Lysol does work. Clorox water does work. But Pine Sol, Simple Green, Fabiosa, that ain't cutting this virus. Okay? You need something that's virucidal. And Clorox, Lysol does. I don't know whether, I know Odabin claims to be virucidal, but hey, you bring that on. You make your wife, you use it, you use a mask, you use gloves if you need to. When you go shopping, grab that Clorox wipe that they have with sanitizer. Wipe down the handle of the cart, I love the way Dr. Sanjay Gupta says, take the bag that you have, bring it in, and wipe off your groceries before you put it away. It's a clean area, and it's a dirty area. Dirty area is where your bag with groceries at. Wipe off your groceries before you put it away. Medical people who are working, and I give my prompts, even though I am in the medical field, I'm in an office. I'm not an EMT, and I don't work the emergency room. That's where I give my prompts, because they're the first liners. They're truly the first liners. The EMTs and the ER department, be it the janitor in the ER department, up to the ER physicians, the respiratory therapists, etc. They're the ones that are being first exposed. And luckily, they're going home, they're distancing themselves from their family, and and some people are actually sending their kids over to other relatives, or their family over to other relatives, or they're camping out in one room, they disrobe in that room, hit the shower, put on a new set of clothes, but that stuff that they came from work is in a plastic bag to be put in the laundry, to be washed immediately.
Okay.
So that's why I say this virus is going to be around, because we don't know, one, who all has it. Two, we don't know all its presentations. Three, we don't have a vaccine to build up our immunity to it at this time period. Nor do we have oral medicine or a shot that's going to fight it once we get it. You think about it. When we have the flu, they talk about get your Tamiflu, get your flu vaccine so that you can build up your immunity to what is going to be a strand of flu for that particular season. We don't have that with this. And the fact that it's supposedly, the myth about, when the warm weather is going to occur, it should be less. That was, excuse my language, debunked when it hit South America and Africa in January, February, March. I mean, that is warm weather. That was still their summer. Okay? So warm weather is not a factor to decrease its incidence. Okay?
Okay.
So,
You know, there are so many other questions I could ask that I'm tempted to ask, but we've been going for a while here now. So I'll just end with this one. You know, there are a million and one reasons for people to worry and to get hysterical. Surprisingly, with Bill Gates and this vaccine, there's been some hysteria over the vaccine whenever it gets ready. Should people be worried about taking a vaccine? What's the angst over
vaccine
this?
is approved. It has gone through a trial.
Yeah.
And the most important thing about any vaccine, it's harm versus good. And I mean, I'm not really one of these research people, and I'm not what I call the geek that has to read the New England Journal of Medicine and all this other fine little research stuff. But the most important thing I've noticed about the vaccines is that they want a very minimal incidence of adverse effects. You know, dealing with the FDA, that when you do something, you want to make sure that its outcome is better than its deficit, which means it does more good than it does harm. And even if it does start to do harm, it's pulled off the shelf and it's reevaluated, or it develops black label on it to say that this is what it is not to be used at all. So with that said, again, the vaccine is going to take a while to come out because there's going to be experiments with, other than animal experiments, there are going to be trials with humans to see what the adverse effect is. And again, what do we have to worry about? We have to worry about the fact that we are genetically the same, but not genetically the same. Okay?
Okay.
We won't get into hypertension, diabetes, poverty, etc. It's an issue on this because that's a big factor too. Okay.
Okay. Well, we'll tackle that the next time. Well, Dr. Strain, it's been a pleasure. Thank you for taking some of your time for us to do this again and to talk about your experiences and your expertise. Definitely would like to have you back on as there are more questions that I can ask and those kinds of things. So hopefully you'll come back. To the audience, I'm going to leave those interviews with the other doctors I interviewed in the description box below. Please like this video. Please share it. Please subscribe to my channel. Dr. Strain, before I go, are you on any form of social media, or if people want to say, hey, I saw you on Dr. Dunbar's channel, is there any way for people to, or if you don't, it's fine.
No, it's fine. The only social media that I'm truly on is Facebook.
Okay.
Thomas Strain. That's the only social media. I'm not a Twitterer. I'm not on LinkedIn. I have enough things to do with me being on Facebook because other little aspects of me is, as you know, I raise show dogs and do show dogs since 1983.
Mm-hmm.
Okay, so I've got that also, another little channel, but luckily that's separate on Facebook. And then I've done other things that are non-medical that people contact me through Facebook. Okay.
Okay. Well, everyone, if you...
One other thing, there's just one other thing I want to say that I forgot to mention. When I was growing up, a wise lady who happened to end up being my brother-in-law's grandmother told me the only one who could stop you from becoming who you want to be is yourself. And that's one of the things, as I said, when I like dealing with kids and motivating them. And in my office, when I start asking them fifth grade what they want to do, etc., I implant that thought into their brains that the only way I can stop them achieving where they want to go is themselves. Because God has given us the hands and the minds to do what we need to do to achieve.
Okay. Yeah. Okay. So we'll thank you, Tommy, and those are very
You're
profound
welcome.
words.
You are.
And we will
You're
we'll
welcome
end this
again,
there.
Dr. Dunbar.
So if anyone tries to friend my cousin on Facebook, don't harass him. Keep it professional. Don't. So in any case, so we'll end there. So everyone, please like this video. Please share it, and please subscribe to my channel. And as always, remember that your attitude determines your altitude. Take care, and I will talk to you the next time. Bye-bye.